Hello and welcome. This presentation will be on osteoarthritis, and the group members that participated in creating this presentation and compiling the information was Riley Kirschmeyer, Rachel Crawford, Kate Gavlik, Jessica Wilkins, and Hala Beyer. So let's get started. Here is an overview of what to expect. So we'll be going over the condition definition, signs and symptoms, age, gender, and risk factors that osteoarthritis affects, the timing and pattern of disease, the onset and outcome of the disease, prevention, conventional approaches, alternative interventions, nutritional supplements, red flags and common complications, risk of undertreatment, nutritional recommendations, and then last but not least, our references, which are all the sources that we gathered this information from. So starting off, we have the condition definition. So osteoarthritis is a progressive disease of joints characterized by loss of cartilage, resulting in bone spurs and cysts around the joint. It's one of the most common arthritic conditions, and it's very painful, as you can see from the picture. The normal joint to your left, you can see the cartilage is perfectly intact, and then the joint to your right, there's developments of bone spurs. You can see that the cartilage has thinned, and then there's also like those little fragments that are floating in the tissue there. So you can only imagine how painful it must be for the individual it affects. Signs and symptoms of osteoarthritis. The individual may be experiencing joint pain or stiffness lasting more than a few weeks. There's stiffness of the joints, pain, tenderness. It's most commonly in the hands, knees, hips, and spine, but it's not uncommon to see them affecting other joints. Other signs and symptoms could be swelling, crunching, or grinding feeling that's taking place in the joints. The individual may be experiencing loss of flexibility, and it's important to recognize that osteoarthritis is irreversible, but the painful symptoms of the disease can be managed, and we'll go a little bit more into some ways that this can happen. Osteoarthritis affects 13.9% of adults over the age of 25, and then of those 13.9% of the individuals, 33.6% are over the age of 65, and this accounts for 12.4 million people. And then women have a higher risk of developing osteoarthritis after age 50 compared to men, and we couldn't quite figure out why that would be, but you can kind of speculate. A lot of these degenerative bone diseases typically happen in women, and due to menstruation and other hormonal factors. Other risk factors include obesity, and this would be because of the excess stress and weight that's being put on the joints, and also there's that underlying inflammation that's happening. Another reason could be joint injuries, and this could be related to sports, work, or trauma. Occupation plays a role, so repetitive movements and stress on certain joints. This could even include sitting or walking. Just anything that's occurring over and over again that would cause some kind of like pain or discomfort in those joints. Genetics plays a role, so if your mom had osteoarthritis, that puts the children more at risk to develop it. Diabetes plays a role. Gout could contribute to the development of osteoarthritis. And then also, if you have rheumatoid arthritis, that puts you at risk as well. Some other possible factors could be estrogen deficiency, could increase the risk. High bone density may increase the risk of osteoarthritis occurring in the knee. Vitamins C, E, and D also showed that if you have lower levels, that could contribute to higher rates of osteoarthritis. And then also higher rates of C-reactive proteins. And again, I believe that's in relation to inflammation. Timing and pattern of osteoarthritis. Risks increase with age, especially for women, as we touched on before. Patterns. Articular inflammation likely is caused by contributing lifestyle choices, which can then lead to degradation of the joint that's being affected by osteoarthritis. Metabolism of the chondrocytes responsible for cartilage regeneration, and that becomes abnormal. Macro trauma and micro trauma combined with aging and inflammatory lifestyle choices also can increase your risk of developing OA. Onset and outcome. So onset typically occurs in adulthood and more prevalent in 50 and over. This is likely due to overuse. That could be running, lifting, which doesn't necessarily have to be related to exercise, but just like lifting on the job during just as like a lifestyle. And then other repetitive movements too can contribute to it. Also trauma, so this includes injury or excess stress to the joint. And then the outcome would be pain management, loss of function, surgery, and then secondary cause of death due to the accident, which can be a little ambiguous, but rates of death are 1.6 to 2 times higher in osteoarthritis patients than healthy individuals. So now the good stuff. So how can you prevent the onset of OA? For women, this would be maintaining adequate estrogen levels. For everybody, lifestyle factors includes weight loss or weight management if you're at a healthy weight, and then regular moderate exercise, so it doesn't have to be anything intense, but just making sure that you're getting out there and getting some movement daily. And then also anti-inflammatory plant-based diets were correlated with low risks of osteoarthritis. Common interventions, we broke it down into conventional approaches to treating OA and then alternative approaches, just so that the person knows that they have options. So for conventional approaches, the standard of care typically starts with being prescribed NSAIDs, acetaminophen, opioids for pain management. Also, joint injections may be given to the patient, and this would be with, I'm going to butcher this, colchicine and hydroxychloroquine. And then, as a last resort, if there's no improvements with the previous 2 treatments, then arthroscopies, joint irrigation surgery, replacement surgery, realignment, fusion, and cartilage grafting are all other methods for treating OA. For the alternative approach, joint massaging, acupuncture, physical therapy can all be used to relieve pain of symptoms. Orthotic devices, and these are typically like placed in like the heels of shoes. It could be some kind of thing that's strapped around like their chest or midsection if it's spinal OA, etc. Heat and ice therapy have been used, transcutaneous nerve stimulation. Sometimes just educating the person and supporting them throughout the symptoms or can help with symptoms, just having them be in like some type of support group that they're with other patients that have been diagnosed with OA and just hearing their stories and how they're coping with it, that can sometimes be very therapeutic for individuals. There's also a lot of natural supplements that can be prescribed to these patients, or I shouldn't say prescribed, but recommended to them. And then individuals with OA, it's recommended a little bit of exercise. So some of these could be Tai Chi, which can also be like a form of meditation, which can be helpful. Swimming, where it's just very light. Walking, if the OA isn't in their knees or hips, it might be bearable for them. And then even just like a gentle, slow flow, restorative yoga would be beneficial. And then this is a continuation from the last slide, but natural supplementation. So some of those we found would be avocado, soybean unsaponifiables. And this is just a blend of avocado and soybean oils. And it can be taken orally or applied directly to the joint, and it's used as an anti-inflammatory and shown to prevent joint injury and promote joint health. Glucosamine, glucosamine and chondroitin were a little bit controversial. There was studies showing that, yes, it's very beneficial, and then studies showing that it had no effect. So it's very much dependent on the individual. So if you don't see any alleviation of symptoms in the patient, it's not to be discouraged, just try another method. So glucosamine, it's a natural compound found in healthy cartilage, and specifically in the fluid around the joints, and it's shown to have modest pain relief in the hip, knee, and spine. So maybe if an individual is experiencing OA in their hand, this may not be the best supplement to recommend. Chondroitin is a major component of cartilage that helps it retain water. Studies show that there was improvement in the hand and knee for individuals taking this supplement. Turmeric, and the dose varies based on the individual, but turmeric reduces inflammation in the joint, so that could be something that would help to alleviate some of those painful symptoms. Fish oil is recommended, or a vegetarian omega-3, and this is just to also reduce inflammation in the joint. Some red flags and common complications in patients with OA. There are reportings of side effects of medications. This could include, but it's not all-inclusive. So GI bleeding, stomach ulcers, depression, and then repeated injury to the joint due to previous OA state could lead to complications. Chronic inflammation is definitely worrisome. Gout and chondrocalcinosis, which are both two very painful pathologies for a patient to experience, so it's beneficial to treat the symptoms and then prevent further complications down the road. Surgical complications, so this could be on an operative joint. There's always risk for infection post-surgery. OA is often a secondary cause of death, as we mentioned before, but there's higher rates of death from heart disease sooner in life, and that's specifically related to OA patients, which is just something to look out for, just because the body's already so inflamed and under attack that it makes it more susceptible to death occurring later on down the road. Risks of undertreatment for OA. There could be increased pain, swelling, loss of range of motion in the joint. Bone spurs may occur on the edges of the joint, and later on surgery may become necessary, which could be prevented if there's an effective intervention that's implemented early on. Nutritional recommendations for OA patients. So in general, you want to increase the consumption of anti-inflammatory foods. There are many out there, and specifically you just want to lean more towards like a plant-based diet because those are anti-inflammatory foods. But here's some less common anti-inflammatory foods that would be very beneficial to start incorporating into the diet. So cold water fish, sardines, salmon, mackerel, herring, they're high in omega-3s, so they're anti-inflammatory. Garlic, which is a prebiotic as well. Onion, also a prebiotic. Horseradish. Nuts such as walnuts, which is again, you're looking at the high omega-3 factor. Seeds such as flaxseed. I'd add chia on there as well. Ginger, turmeric, and avocado are also things that should be incorporated into the diet. You want to ensure that your patient's avoiding refined processed foods and dairy because these are pro-inflammatory and they come in all shapes and sizes, so it's just important to educate your patient on what these may look like. And it could be a good way to open a discussion about how to find some good, healthy substitutions. Consume blood movers to promote vascular integrity. So blood movers, this could be an herb, a spice, and then we also have like some supplements too, but you want to look at ligament and cartilage supporters, bone broth because it contains the good collagen, which would be great for supporting your joints, Gatu cola, and nettles, which are shown to support your connective tissue, so that might be something that your patient would be willing to try. And then also you want to increase antioxidants and vitamin K rich foods, such as fruits and vegetables and whole grains, which are all anti-inflammatory. And then more specifically, you want to make sure to incorporate turmeric and then fish oil, which were mentioned on the supplementation page, but just to reiterate, these are two very effective foods that are fairly easy to incorporate into one's diet. And then cayenne, which is beneficial as well, and then garlic and ginger too would be some other foods to look at incorporating into the diet. Then lastly, we've got our references page. And then it continues. And I just want to thank you for taking the time and listening to our presentation. Yeah, have a good one.